Murphy, a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Morning.
What does India need to do better to turn the corner on this?
Well, the Indian Medical Association called for a lockdown in the entire country 20 days ago. And the government left it up to the states, so some have done it and some have not done it. This has got to change. They need really strict lockdown. And this problem with the fungal infections, mucormycosis, is just adding to the complication.
Now, how does that happen? Talk about those fungal infections, why we've not heard about those before.
Well, it's a fungal infection that's very common in wet areas in the tropics, like in India. And, you know, they're getting a lot of steroids, these patients that are ending up in the hospital, because we know that steroids help with COVID. However, steroids also set you up for opportunistic infections like mucormycosis, and they have a lot of mucor, and it's just a bad, unfortunate combination.
I see.
All right, and what about Florida? How's Florida doing these days?
Florida lifted their restrictions a little too soon, as usual. I don't think they have any restrictions down there, actually. But what they're having down there is a resurgence in the variants, multiple variants. Now, they don't check that much, but what they do check is really bad. They have the Brazilian variant, the South African variant, the UK variant, all these variants. And this is causing an increase in the mortality rates in the hospitalized patients.
Overall, though, we're hearing from Dr. Fauci that nationally the U.S. is turning a corner. Is it 60% of the population needs one dose of the vaccine?
Well, that's about where we are now. It was, so Dr. Fauci has made some comments, oh, we're getting close, but we have to be 70 to 85%. Scott Gottlieb, the former FDA commissioner, he said, you know, at 60%, we're going to start seeing a slow decline as the vaccination rate increases. But the point is, we still have to keep vaccinating people, but there is light at the end of the tunnel, Robin.
All right, let's take a look at viewer questions. If you had COVID and tested positive for long-term antibodies, why get vaccinated? They can't determine how long antibodies last for the vaccination. Don't they both provide the same protection?
Well, this is a great question. We've been talking about this for a long time in the science circles. You know, when COVID first came out, we said, oh, you get COVID, you don't get COVID again. Then all of a sudden we started seeing people get COVID the second time after about 3 months. So what happens is, you can't predict how good your antibodies are after you actually have the disease. The vaccine gives very potent antibody protection, better than and more consistent than with the disease. And that's why the recommendation is, even though you've had COVID, even though you can measure antibodies, you need the vaccine to get full protection.
All right. This person says, according to IDPH, soccer players are required to wear masks while on the field and off. Some parents are saying breathing in that much CO2 and the bacteria associated with the masks during aerobic sport like soccer is far more dangerous than the extremely minimal risk of contracting COVID while playing an outdoor sport. Please comment on these concerns.
Yeah, it's not really a risk to people wearing the mask. It's uncomfortable. You know, you're exercising very aggressively and you've got the mask on, you know, they're not going to get any significant problem from that mask. Those masks aren't that. They're not wearing K95 or N95 masks, you know. But anyway, it brings up the good point that, you know, I think very soon they're not going to have to wear masks anywhere outdoors, even in sports. You know, vaccines are approved for kids down to 16. This week, they're meeting on Wednesday. It's going to go down to 12. And they're even testing people younger than that. So, you know, I think these teenagers need to get vaccinated. And then when fall comes, you know, they're going to basically end up with a normal school year.
All right. Another question. My 90-year-old father was stuck in Brazil due to COVID. He received the Sinovac vaccine in February and March. He is returning to the U.S. in July. Should he get the Pfizer or Moderna vaccine?
Well, this is another good question. There is no formal guidance on a question like this. This is going to have to be a personal decision with the doctor and the patient. Now, what the problem with the Sinovac vaccine is that the efficacy rates are at the bare minimum. They're some as low as 50% effective. compared to the mRNA vaccines, the Pfizer and Moderna vaccine, which are up in the 90 to 95% range. So this person is coming in with vaccination, but not that good. Basically anything can go. If it were a personal decision for me, since this person is 90 years old, I would give him a booster right now with a Pfizer or Moderna vaccine.
All right. If you have a question for Dr. Murphy, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow at this time. Thanks, Doctor.
Thanks, Doctor.